Hello, my name is Belinda Jessen with LifeNet Health. We are your tissue bank, and I am also here representing SiteLife, who is your eye bank. And we work closely with the Organ Procurement Organization to help support the donation program here at the hospital. And today we're going to talk about tissue and cornea donation and the referral process and the critical need for tissue grafts. I think more often than not, when we think of donation, we think organs, not realizing that tissue grafts can also be recovered and transplanted successfully. Every year, over 1.75 million people's lives are enhanced through tissue donation, and we can actually recover up to 150 grafts from one donor. So just to put that into perspective, last year we were able to recover from 72 tissue donors here at the hospital. So you can imagine that's a lot of lives that those donors here at the hospital are enhancing in our community. So what kind of tissue grafts can be recovered and transplanted successfully? Skin, bone, tendons, ligaments, heart valves, veins, and corneas. These are all considered tissue grafts, or gifts as we like to call them, and they all can be recovered and transplanted successfully. And these grafts can be used in a multitude of different applications to help enhance lives. We're going to go over a couple of different tissue donation referral facts. There are certain rules and regulations that are mandated through CMS and Joint Commission around donation. And we're going to talk about a few of those. The most important one is upon death, every patient will be evaluated to determine tissue donation suitability. So it's very, very important that regardless of the decedent's age or medical condition, that a referral call needs to be made. And more importantly, that referral call needs to be made within 60 minutes of cardiac death. It's really very simple. All you really need to remember is that if there is a death, you need to make a referral call within 60 minutes. So, is there ever a scenario where a second referral call needs to be made on a patient when a first referral call has already been made? The answer is yes. For those of you who are working with vented patients, when that patient meets clinical triggers and you make that first referral call, that patient at that time is only being medically evaluated for organ donation. If for whatever reason that patient is not deemed medically suitable for organ donation, they still can become a tissue donor. So that's why it's very important that you make that second referral call. If that patient lives another day, another week, another month, if and when cardiac death does occur, again, that call needs to be made within 60 minutes, just like any other death. It's very important not only to make the call in a timely manner, but to place the decedent in refrigeration as soon as possible, ideally up to 8 hours after cardiac death. We only have about a 24-hour time frame to make that first incision of recovery, and there's a lot that we need to do within that 24-hour time frame. So that's why it's really critical that that call be made within 60 minutes and that that decedent is placed in refrigeration within 8 hours. If the decedent is not placed in refrigeration within 8 hours, then we only have a 15-hour time frame to do what we need to do. So again, very important that those steps are done. We do the recovery in an aseptic OR environment. That could be here at the hospital's OR, or we do have a surgery suite in our offices in Renton. It's also really important to note that once recovery is complete, we do a full reconstruction of the donor. Regardless of the family's choice of an open casket, a closed casket, or cremation, we are still going to take the time to fully reconstruct the donor. If we remove a long bone, we're going to replace it with a biodegradable bone. As you know, families change their mind. They may want to say one last goodbye to their loved one, and it would be quite devastating if they were to view their loved one not as they remembered them. And it wouldn't just not be devastating for the family, but really donation in general. So we want to make sure that the donor and the donor family are cared for with the utmost care and respect. And so it's very important that we do that for them. Corneas are actually the most transplantable human tissue. Worldwide, there are over 12 million people who suffer from corneal blindness, and a corneal transplant can actually help them see again. There is a procedure that we ask you to do in order to ensure that the cornea stay viable, and that's the SEE protocol, S-E-E. The S stands for Saline Rinse. We ask you to administer a steady stream of saline in each eye for about 2 to 3 seconds. And then once that's complete, we ask you to elevate the head at a 30-degree angle, typically with Chuck's pads. And then once that's complete, we ask you to close the eyelids. And if they do not stay closed on their own, you can use a little bit of paper tape, but please no gauze, no ice, and no ointment. And this helps, again, ensure that the cornea stay viable. There's actually 2 reasons why we ask you to elevate the head. It clears out any debris from the eye after the saline has been administered, and also it helps to reduce facial edema because that edema can actually damage the cornea. So just a quick review of the process. Please make sure that you are making that call. Really, if you can only remember one thing from this presentation today, it's critical that that call be made within 60 minutes of cardiac death. We want to make sure that you are comfortable and confident in making that call. We are going to guide you through the process. We're going to remind you of certain things to do and certain things not to do. But again, it's very, very critical that you just remember to make that call within 60 minutes of cardiac death. We, of course, could not do what we do without this generous gift that the donor family has given us and the donor themselves. We have all kinds of wonderful celebrations throughout the year where recipients and donors come together. We really have a wonderful donor family service program where we support the family through their grief journey. Again, we want to make sure that they are cared for with the utmost respect because of the enormous gift that they have given us. And of course, we couldn't do what we do. We couldn't fulfill our mission of saving lives, restoring health, and giving hope if it wasn't for each one of you in making that call, because that's where the process begins. So thank you very much for your supportive donation, and we wish you the best of luck here in your new endeavors at the hospital. Thank you.